Good morning and welcome back to Morning Express this 18th day of August. It is now 8:24 a.m. and for the next half hour or so, we want to talk about depression. Of course, you all know of the death of Robin Williams that happened last week. And one of the things that he's said to have suffered from for a long time is depression. And that just reigniting the conversation, it is one perhaps that as a country we need to have had more before and much earlier, because it is an issue and a disease and condition that's affecting many people. But we don't get to hear about it much. And joining me in studio are two experts to help us analyze what this is all about and how it manifests and how best to handle it. We have Winnie Kitetu, who's clinical psychologist with us, and of course Dr. Catherine Mutisya, psychiatrist. Thank you both for joining us. We'll begin with Dr. Mutisya. You were here a while back and we're talking about mental health then, and we did not get to delve into depression, but it is one of the, it's a condition, disease you touched on that is part of mental health. Talk to us about what depression is when we're talking about depression.
Thank you very much. Depression is a mental disorder which is characterized by one feeling sad. It could be most of the time. Feelings of worthlessness, hopelessness. Sometimes there might be accompanied physical symptoms like loss of appetite, lack of sleep, loss of libido. And we say that by the time you are diagnosing depression, this is affecting your social life and also your work life.
Okay.
Yes.
What gets people to that place, Kitetu? What gets people depressed?
You see, we all get sad in one time of their life. Maybe one day you are sad. You also have blues. But what you're trying to say here is if the symptoms persist for about 2 weeks, then you diagnose it as depression. So you could be sad, you could be down with issues, you could be feeling bad, but if there's a lot of emptiness, hopelessness and despair, then we say you are maybe suffering from the clinical depression. What gets you into this? It is the usual daily problems, stress, lack of family support, joblessness, war, sickness, sometimes drug-induced, sometimes just the environmental stressors. They could get you to this. And also, we also have depression, which comes from the genetic, if you have a family history, so you can also get depression. Yeah.
And if you'd like to be part of our conversation this morning, if you have any question for our doctors, our phone numbers will be on your screen. Do call in and participate. You can tweet me at Sophia Wanuna. Dr. Mutisya, so this life has many pressures. So for these people, one would argue, what is that thing that about them that they're not able then to withhold, to be strong, if some may put it that way, during these tough times? Because everybody has a hard time at one point or another. Challenges are there. Life is such. So what is it about this people that it gets them so bogged down?
Just like Winnie has pointed out, that sometimes the fact that you have the genetic predisposition and then a trigger arises. A trigger could be some stress like trauma. It could be a loss of a loved one. It could be an economic crisis. It could be an adversity in your life. Not everybody who gets such adversities will break down. That's why we are talking of the biological aspects of this depression.
But is that the only cause? Because then they're not all, predisposed to this. It's not all genetics. What about those? It's not genetics. What is it about them that then it's easy for them to go down that road?
That's why we say some of the protective factors when it comes to mental health include a good social support, good physical health, because if some depression could actually be coming as a result of medical issues. For example, if your thyroid is not functioning well, hypothyroidism, you could actually suffer depression. If you have a chronic illness, physical illness, that could also predispose you to depression. But again, I'm saying, in most of the time, there is the genetic predisposition. We know very well that the other biological aspects include chemicals in the brain we call neurotransmitters. When there is imbalance in that, then one can get depression. We also know specifically in women, there is the premenstrual tension, which we call premenstrual dysphoria. Some women suffer from that. There are women who will also suffer depression postpartum after they deliver. We also get some women suffering depression at the menopause time. That's why we also know that hormonal imbalance in the body can also make you have depression.
Okay.
Yes.
The one after, especially childbirth, is usually, especially when it's planned, you know, they wanted this baby, but the women who get themselves in that place, it's all the hormones, or are there any contributing factors to that?
You see, with that one, there's a drop, sudden drops in hormones, because when you are pregnant, there are some hormones, we say estrogens, progestins, which are playing a role, and they were raised levels. But all of a sudden, when you give birth, there's a sudden drop. And then, like the postpartum psychosis is usually also the way Dr. Catherine is saying, inherited. So it must have gotten it from also parents. So you have the genes which are dormant, but because of that. And then also it is the fact that your social and psychological status is changing. The fact that there's a baby here. It's actually, you are like shocked. You are prepared for that, but it also comes as a shock to you. So because of that, it triggers, and then you go down with depression.
Is it easy to diagnose depression, and especially for loved ones? Because then for you, perhaps as the experts, it will be easier. But what do you say to family, friends? Because then they're the ones with everyday interaction with these people who may be affected. What is it to look out for?
Yes, when you are dealing with your loved ones or family members, we always say that depression is about how you feel, how you behave, and how you react to situations. So if you had this person who had a passion, for example, for hobbies like football, or they are very happy to go to work, they are excited about work, and slowly you start finding them asleep at 10, they don't feel like waking up, they don't feel like showering, they don't feel like doing the things they would they used to like doing. Then when there's that change, then you need to have them evaluated. And I had said initially that sometimes we need to rule out other medical conditions. We make sure that this depression is not happening because there's something physical in your body, like I said, the thyroid, like another disease. So once when you see those changes, you need to have that person evaluated. Mild depression, people with mild to moderate depression can actually sense. You can tell I'm not feeling well, but when it's severe, this person might not even realize. So it will call upon the family members and the friends to actually help this person. Some people might even go to the extent of suicidal ideations. And when somebody talks of suicide, we say that is an emergency. So if a loved one says, I feel I'm better off dead, or they make such comments, don't take them lightly. You need to make them have somebody watch them before you can actually take them to hospital. Yes. So
because that's where I was going to go. So after you've realized this symptoms, you've been able to notice some of these things happening with someone, so you advise, because you say for example, they don't even want to accept it for themselves, to tell them that they're depressed. So to tell somebody, okay, let's go to hospital, you're depressed, you need to see a doctor. How do you manage that conversation to getting somebody to seek that help?
You see, like it's actually hard for you to accept. But most of the clients we have with us are women, because women, they are very easy to go and seek. When things are not working, they always sense. Men, is a bit hard to go and seek medication or to go and seek help, because one, they don't want to accept that they are going through those experiences. And how do you tell that there's something wrong, especially if it's a man? This man, because of the problems it's been having, he normally turns it inwards. So he internalizes his problems, and how do they come out? It turns violent. And then also you can see symptoms like poor performance at work, is absenteeism, and also it becomes very irritable, and then disturbance in work, in sleep, in eating, and like that. So if you are a close wife to this husband, then you should be able to tell there's a problem, or if they are relatives or brothers, because all of a sudden you are violent, you are fighting. Then if it's a boss, even at work, you are so irritable. You are easily angered, so you cannot even outburst, you cannot even negotiate anything. So you decide there's a problem. And then also men, they turn to alcohol, to drugs. So you're drinking a lot to hide the problem. So that's when the employer comes in and decide there's a problem, let's help this man, or the family members come in. But for them to take themselves to the hospital is not easy. For women, we easily know. Like for example, during the one Dr. Catherine has said, the premenstrual depression, that one, there's a lot of tension and irritability when you're about to get your menstruation. And then there's a lot of anger outbursts, and you cannot even agree with anybody in the house or even at work. You even feel it. And this is very common to women, like most of them are women who are like they take alcohol, or those who are overweight, who don't do exercises. You find that easily they get into this depression. These ones can tell there's a problem. Why am I at that period? And then when the menstruation comes just like this, the depression goes. So you tell there's a problem, and that's when you seek help. So we have more women coming to seek help voluntarily than men, because women wants to work out their issues.
So there are those who realize they have a problem and will seek help, as she has highlighted. But then there are those who don't realize, and then they're so deep in this depression, those around them realize, but to get them to seek that help, how do you handle those situations?
Yeah, that is a very good question, because we see that a lot. The Mental Health Act provides for that. That there are basically like 3 forms of admission for severe mental illnesses, for people who lack insight, people who don't understand they're sick. You can actually seek treatment voluntarily, and the Mental Health Act allows that. But you can also have involuntary admission, where this person does not accept that they don't understand that they are sick, and so it requires the next of kin to fill in, apply for admission. And it's not just the next of kin. The Mental Health Act requires that as much as the next of kin will go to the hospital and apply, this loved one, my family member, I feel they are sick because they are behaving this way, or they are doing 1, 2, 3, or they are not doing 1, 2, 3. The Mental Health Act requires that a medical practitioner registered should actually assess the patient and also fill another form saying that I have evaluated so and so on this date, and because of 1, 2, 3 I diagnose that they have a mental illness, and because of 1, 2, 3 they are not in a capacity to understand they are sick, and so they require the treatment. So the law allows for that through the Mental Health Act.
Okay.
Yes.
It's good you say that, because there are many, I'm sure, who find themselves in those positions where they want to help this person who's not accepting or cognizant of the fact that they're unwell and they're stuck. You have, both of you mentioned some of those symptoms, some of those effects of depression. You talked about suicide being very extreme cases where people want to take their lives. Talk to us about some of the others. You talked about a lot of sleep. They just want to sleep, not to do anything. What else would exhibit during this time?
Yeah, we've talked about the physical symptoms,
Right.
where we've said some people might have digestion problems, they might have excessive sleep, or some people lack of sleep. Some of them might be irritable, some of them might resort to abuse of drugs, to what we call that self-medication. And again, we said that the feeling of hopelessness, the feeling of feeling like there's no need to continue with life, all those symptoms. And sometimes we even have atypical symptoms, where, especially in children, a child who like refuses to go to school, they'll start talking about stomach problems. When you take them for evaluation, there's nothing wrong, there's no physical problem. A child who outbursts, that's crying. So for children, actually, you need to be very careful, because we are seeing a lot of depression also in children and adolescents. And their symptoms might not present like the usual adult. It might just appear like they are disobedient, like they're arrogant. So it's good to sit up with them, create the environment, really find out is anything else going on. Yes.
It's interesting that you bring up children, because many, would not perhaps be easy to catch it. You just think there's a rebel right here in the house. So how young are we talking when you say children?
Yeah, we're talking about, this starts with 6 years or something less than 10 years. Why is this? Because you easily notice we have children who throw tantrums. And they throw tantrums at the age of 2 years, 3 years. Why? Because the linguistic is not yet, the skills are not yet been formed. But here now the child is grown, is 5 years, 6 years, 7 years, and is throwing tantrums, anger outburst, and they're so irritable. So because of this, the parent is able to know there's something wrong with this child. The peers, you cannot play with the child. The teachers are also able to know. And then you also see there's a lack of concentration in class, poor performance, and also relationship. The child cannot relate well. So the parent should be able, although it is a long process for the parent to know, because it takes about even a year, the child struggling with that. But the outburst will come like 3 times a week, or sometimes the mood will remain there nearly every day. You are moody, but just touch me like this, just throat, it goes up. So the parent should notice her children, 6 years, going to 10 years, and even early teenage.
An early teenage.
Yeah.
In the question of where this, in treatment, you talk about part of it is seeing a counselor, somebody to talk to. With the different, there's the mild, you said, there's a medium, then there's the very severe depression. So how do you treat each? Start with the mild.
Yes. When it is mild to moderate, you may not even need medication, psychotherapy, and that's what clinical psychologists do, would be able to deal with that. Sometimes it just requires somebody, if it's mild, to be given skills as to how they can organize their life, how they can prioritize their life, because sometimes probably this person is overwhelmed. It might just be counseling to live healthy lifestyle, exercise, eat healthy diets, don't skip your meals. It might be that simple. When it's moderate, now we start talking about intensive psychotherapy provided by clinical psychologists. When it is severe, moderate to severe, you need to combine both medication and also psychotherapy. We also have very severe depression where probably this person is having suicidal thoughts. And you see, because of antidepressants, they take about 2 weeks to work because of the mechanism of action. You know, there is imbalance in the brain, and the medication are supposed to change that. It takes about 2 weeks. So when it's very severe, sometimes we even do what we call electroconvulsive therapy, which will wake up the patient very fast. What
is that?
This is a treatment which is done in theater by psychiatrists. Somebody is put to sleep under general anesthesia, and it's a current pass through the brain, which increases the flow of these hormones into the brain, and so the person recovers very fast. So when you are dealing with severe depression where this person has suicidal thoughts, when you are dealing with severe depression where the person, you know, we get severely depressed patients who are in catatonia to the extent that they cannot get out of the bed, they're not eating, they are at threat of getting bed sores because they are just in bed, they are in the threat of getting dehydrated because they have refused to feed, they have refused to take medication. And antidepressants are basically swallowed. There are no injectables. So you find that if this person cannot even swallow medication, then you can't just wait and watch them deteriorate because they're in danger of getting dehydration.
We have a caller online before we continue with the conversation. Very well said there. Judy Maina is calling us from Nairobi. Judy, good morning.
Good morning to you.
Thanks for calling.
Yeah, thank you.
Go ahead with your contribution.
Actually, I can see the doctor was addressing a little some part of it. The question here is, my mother-in-law has been suffering depression for more than 10 years. And she's at the stage where she doesn't eat. She feeds on tea every other day. And she doesn't shower. She doesn't trust people around her. And she talks to herself. So there was a time that she was saying that if she can get away from my father-in-law, she thinks she can be able to recover. We were wondering whether she is a person that we should take to Madari, or is there an institution where such people can be taken care of? Because I know even if we get her to a doctor and she goes home with medication, she will not take it.
So,
she says wondering how we can help her.
Okay, and the doctors will answer that. But just a quick one on something you mentioned. She says if she's away from her husband, she feels she'll be okay. Her problem is the husband?
I would say that's it. She says that her cause of depression is my father-in-law.
Okay.
Yeah.
All right. Well, Judy, thanks for calling. The doctors will... You want to start and say something about that?
Yeah, probably we have chronic depression, and it started long time ago. And this chronic depression goes on, and somebody like a woman, you believe that is the way I am. This starts with low self-esteem, it starts with the lack of concentration, fatigue, it starts with suicidal ideation and lack of interest with the environment. Now, probably this was the lady has been going on. And now, because it's there, it's the major cause is marital problems, especially to women, because we are not able to take that. Even men also go through that. But as for admission and whether it should be able to take it to a special place, I'll leave it to Dr. Catherine to answer that.
Yes,
Yes. Yeah, thank you very much, Judy. First of all, I would advise Judy to have a proper evaluation of her mother-in-law, because as much as she might be having some depressive symptoms, she could also be having what we call paranoia, because we are not sure whether actually there's a problem with the relationship. It could be true there's a problem with the relationship, but there are people who, when they have certain mental illnesses, they become paranoid, and the first people to will not trust are the family, immediate family members. So it will be very good for that particular person to be evaluated. And again, when it comes to treatment, psychiatric services or mental health services, you can either get them in private or in government hospitals. So she talks of Mathare Hospital, she can be assisted there as well. And again, it's not just Mathare Hospital. All former provincial hospitals have mental health services, so she could also be treated there. And again, if they prefer private, because the government realizes that the public sector might not be able to provide for everybody, that's why also the private sector comes in. So you could decide where you would want to have a seek treatment, but she needs to have a proper evaluation to be sure of what we are dealing with. If she has no insight, Judy says that she believes that her mother-in-law might not even accept medication. That will mean then she will need admission. And when a proper diagnosis is made, there are other mental illnesses where you can even use injections. Like we are talking of psychosis, you can use injections. The only illness which has no injections is depression. So when you have proper diagnosis, then she can get the right treatment. But for her, she will need admission since she has no insight.
Okay.
Yes.
But definitely you say a big one to start, the place to start is an evaluation.
Yes.
And that may lead to these other things. But 10 years, I mean, this says, because I'm imagining even when, the news of Robin Williams came out and that he'd been struggling with this for a long time, we rarely get to see sometimes what people really battle with. So for somebody to be dealing with this for 10 and others it's for a long time, can you get to a place where it's cured, that, okay, you are depressed, you underwent this treatment and now you're good? Or are you always at risk of, getting back there? And what should people know who have suffered depression?
I think 10 years is quite a long time, but with such a patient now, when they come for evaluation, as Dr. Catherine is saying, we combine both psychotherapy and also medication. Because with the psychotherapy, this person has been having consistent flow of negative thoughts. So the psychologist helps to change the way the person thinks, the way you take things, because it's basically to do with your mind. So it is the negativity, the negative thoughts which have been preoccupying the mind of this person, and the thoughts are so irrational. So when the psychologist deals with this person, with the help of medication, even if there's admission or any other help, then the person will be able to change. Yeah, you find there's a lot of crying with this person, low moods, self-esteem and everything. But with that, the combination of both psychologist and psychiatrist, the patient will get help.
Dr. Mutisya, are they always at risk of sliding back even after the treatment, after the counseling, whatever it is? Is there always that risk that they have to be conscious? Any day you could go right back to where you were, that you must be careful?
Yes, that's why the treatment of depression is long-term.
Oh, okay.
For a long time.
Right.
And when it comes to psychotherapy, you require several sessions and you require a lot of support. Medication for depression, we don't give it for less than 6 months for us to be sure that the illness does not relapse. There are others where you would still give that treatment, and many years later a trigger happens and the illness sets in again. So it's very common to also have relapses, because we are saying, it is biochemical changes in the brain, sometimes genetic predisposition. So people should not be scared that in future they might get a relapse, or when they get a relapse, they should not say that probably the treatment was not right. Sometimes you can have relapses. Okay. But what is important is when you realize there's a problem, then seek help, seek medical help.
Yeah, but also something we were talking about earlier when you said that it's women mostly who will come out to talk about, their issues and say that they're depressed. It's our culture that depression is not something that say, oh, it's, because in the US and other more developed democracies, it's accepted, people will talk about it, it will be easy to catch and treat. But here it's hard, and I guess that's why it's important to have these kind of conversations, that yes, it's happening, and it's all hope is not lost. This can be managed or treated.
Yeah, it's that's why we are here.
Yeah.
And over time, people have been looking at mental health as something which you hide, the culture, your problems, and even the fact that you're going to see a counselor, a psychologist. People hide because they imagine now, they say umechizi. But it's not that there are so many problems which you can deal with a psychologist, even financial management, stresses, job-related issues, your own health. You get a lot of education from there. So I think it's change of attitude and seeing that field of mental health as a field which we should all come visit and you try to get, because there's no health without mental health. Yeah.
Okay. We have Matthias Twenje calling us from Mombasa. Good morning, sir.
Good morning. How are you?
I'm well. Thank you so much for calling.
Yes.
Go ahead.
Allow me to use Kiswahili language.
Yes.
Yes. Na nilikuwa nauliza nimekuwa na hiyo na shida ya kukosa kulala. Nimekuwa na insomnia for a long time. Since I was in class from 2. I'm 30 years right now. Nimekuwa na hiyo shida for a long time. I've been going to the hospital, getting treatment. Nimepewa dawa zile za kusaidia kulala. Nimepewa madawa mingi sana. Na nimeenda kwa counseling. But all of them kuna kitu imenisaidia sasa. Yeah, hiyo kitu bado naweza lala usiku, naweza lala only 1 hour. Alafu the rest of the hours nimeweka kufa, nimefunga macho. But then nasikia hiyo akili bado ni kama inafanya kazi kama kawaida kama vile mchana.
Na ukienda hospitali wanakuambia ni depression ama wanasema nini ndio inasababisha hizi shida?
Wanasema upate counseling. Mara ninaenda ninakuwa counseled, but nothing is helping.
All right, Matthias. Asante.
Yeah.
Okay, we also have Quinta Muganda online. Quinta, good morning. Quinta?
Good morning. How are you?
Good. Thanks for calling. Go ahead with your contribution.
Okay, I do come from Kisumu. I have a problem. I was separated from my husband some 8 months ago.
Okay.
My husband used to beat me seriously that I could not handle the situation and I decided to leave. So wherever I go, even in my dreams, I just dream that this guy is beating me seriously, and when I wake up in the morning, I feel that I'm hopeless. My life is just meaningless. I'm tired. I can't do anything. And the fact that I'm staying away from my children also is killing me, and I'm really afraid of this man, and I cannot even go back to him because of the fear of him killing me, because he threatened many times that he could kill me. So I don't know what to do with my life because I'm really tired, and I need your help, you guys, to help me if I can move on in my life.
All right. Thank you, Quinta, for sharing. It's brave of you to do that, and of course our doctors will address your concern and issue. Thank you so much. Let's start with Matthias. Matthias talking about insomnia. He's not been able to sleep for a very long time. It's mentioned from when he was very young, and that he's gone for counseling sessions, but the problem persists.
What I can tell Matthias is that mental health is a combination between a psychologist and a psychiatrist. Probably a psychologist who knows you cannot really treat depression or such mental health problems without referring to a psychiatrist or having a psychiatrist near you, because at one time this person will break down. This person, you notice that he's also detached from the reality, and that's when you need to refer. You cannot do it alone. So this counselor, probably there was an issue which Matthias need to be addressed by a psychiatrist, and he needed to refer, and he hasn't done it. Otherwise, there are some techniques which you also use which can also help the client. But the thing is, we have to work together hand in hand, psychologist and psychiatrist.
Okay. So what should he do now, Matthias?
Yes, I would also want to emphasize on correct diagnosis. Because when we are talking of sleep disorders and depression, those are two different diagnoses which will be treated differently. And so with the sleep disorders, first of all, we need to rule out, is there any other medical issue which is causing these sleep problems? There's something we call sleep hygiene, where we make sure that you don't take coffee at night, that you don't watch stimulatory movies or
at
night, that you exercise early during the day, not late at night, because when you exercise late at night, it will interfere your sleep. Basically, no coffee, no watching TV in the bedroom, slow music. So when we talk of sleep hygiene, we need to be sure that he's actually having the sleep hygiene. And if he's having sleep hygiene and counseling and still there's no improvement, then we need a reevaluation. Was their diagnosis correct in the first place?
Right.
So that's how I would look at it.
Okay.
Yes.
So he needs to see an expert to be able to get a correct diagnosis. So seek some special attention for that. Let's go to Quinta. And sad story there. Been separated, I think she mentioned 8 months, not with her children, and it was an abusive relationship, and she has these nightmares and is living in constant fear, and also getting to a point where she doesn't want to leave and is scared. Really just a sad picture she's painted for us. What do you tell her?
Yes, when it comes to marital problems or relational problems, it could not necessarily be marital, it could even be parent-child relationships. Such stressors, when we have relationships which are not working well, can actually push somebody to depression. But to her, she seems to point more towards what we call post-traumatic stress disorder, where you are traumatized and you keep getting reminders. You remember the incident all over again. So this person needs proper assessment and correct treatment. It might not actually be depression, it might be what we call post-traumatic stress disorder. And that's why I keep emphasizing that you need proper evaluation, proper diagnosis, because each disorder is treated differently. So if you are given the wrong diagnosis, then even the treatment will be wrong.
So, and where do people go for this disorders, for this treatment? Because it is then about getting it right from the beginning, because you get it wrong and then it's a problem. And also we have a question on SMS. Somebody's asking, which government hospital can patients go to for psychiatric help? So where are these places that people would go and what experts, professionals, they seek this help from?
Okay, there are so many government hospitals, like Kenyatta Hospitals as patient support center, where they can go and seek help. We also have, there's Mathare, of course, but I don't know Mathare is referral, maybe Dr. Catherine can talk about that. But there are so many clinics which have come up, which you can also Google, which are genuine, has registered psychologists and psychiatrists, which you can seek help. You just need to go to Google and Nairobi, various hospitals have psychologists also in there.
For the government?
For the government, I would say let people not suffer in silence. Go to the nearest health facility. Even if it's a health center, even if it's a sub-district hospital, even if it's a district hospital, we trust that the people who are there will be able to refer you. They may not be able to give you the correct diagnosis, but they will refer you appropriately. If there's something they can treat there, then they'll be able to treat you. So I would encourage everybody, wherever you are, just get out and seek the nearest health facility, whether private or whether government, and we hope that the people will actually be able to either refer you, or if it's something they can manage, they'll be able to manage them.
Well said. And there's another one asking about whether it can cause suicide, and I guess we have seen that it can be that serious, right?
Yeah, absolutely. It can really trigger suicide because there's a lot of hopelessness, worthlessness, and feeling like you no longer want to live, no energies, and you're not eating. Sometimes you are eating. So most likely depression can lead to suicide. It has actually.
I think one of you mentioned this. Somebody's also asking, can somebody be depressed without knowing? It's possible, right?
Yes. When it's severe, you might not realize that you are unwell, and so it takes people near you to actually see there's something wrong and help you seek treatment.
Okay.
Yes.
Before we wrap it up, that we talked about depression, what effects you'll see, the triggers, some of them. What to do to avoid getting to that place? Because challenges in life, lows and ups and downs, those we cannot avoid. Everybody, one of us has those. So what life then, as the specialists, as the experts, do you tell people they need to lead and need to focus on to avoid getting into those places?
Okay, self-care. Eat healthy, lead a healthy lifestyle, do exercises, have healthy social network. Family network also is very important. Read books which are interesting. have strong spirituality. At least you believe somewhere in a higher power somewhere, and getting friends, and also like getting to listen to music, getting to a company which you think you make you positive, and avoiding negative companies, and generally changing the way you think.
Yeah,
it's very important.
Wow, well said. Doctor, finally for you.
Yeah, thank you very much. In addition to what Winnie has said, everybody needs to discover the hobbies they like and put some time to that, not just working throughout. We say that we all have a child inside us, even the adults. You need to create time to have fun. You know, most of us work and work and work, and we don't have time for pleasure. So it's important to do that. And we say that when you say somebody is mentally healthy, we say that this person is able to adjust to adversities in their life. They are able to relate well with other people, and they are also able to meet their potential. So if you find that that is missing, then you need to visit a mental health specialist. And I said some cases it's just an evaluation and counseling. Sometimes you'll need intensive psychotherapy, and sometimes you'll need a combination of the both of them.
And Dr. maybe to emphasize that, especially for the men, that it's not a sign of weakness to seek help, right?
Yes. Actually, we find many men, when they attempt suicide, they succeed. Wow. So when men actually attempt suicide, unlike women will use less severe means, and they might actually be rescued. But when men attempt suicide, they do it thoroughly, and they end up succeeding. So I would encourage men out there that it's not wrong to seek help. And when things are not right, don't just sit at home and deteriorate. We know that when you're not mentally healthy, you're actually not even able to provide to meet your potential and provide for your family. And I know with men, their self-esteem is tied to productivity. So if you want to be productive and meet your potential, it's good to make sure that you are mentally healthy.
Mentally healthy. Winnie Kitetu, clinical psychologist, doctor, and Dr. Catherine Mutisya, psychiatrist. So thank you both for taking time to be with us this morning. An important subject, and I think the bottom line and the message, the take home for everyone is that you're not alone, and no matter what happens, you can always get out of it, and that there's help available. As you heard from Dr. For many of you, the question was where to get that assistance, and even if we might not give you particular clinics or hospitals where to go, you can always ask and get a recommendation or referral from your closest health facility. But bottom line, you can always go through whatever it is. You just have to put your mind to it, and you've had what you've been told, great friendships, that higher power you believe in, to pray to that, and of course very important to live a healthy lifestyle, exercise, work out, have fun, go bungee jumping, get your adrenaline going crazy, but don't kill yourself in the process. Thank you so much for being part of the show. It's a delight for us to be with you. On behalf of everyone that made the show possible, we wish you a lovely day, and we'll see you again tomorrow. Take care.